So I want to talk about foam rolling. You may hear it synonymous with trigger point release, myofascial release, self-massage, all of that. And the purpose is, let's talk about fascia. Why are we working with fascia? What is fascia? So fascia has become, much more well-known in recent years. Talking to, various fitness professionals, yoga teachers, physical therapists, anybody movement related. Basically fascia is the webbing, intracellular webbing network between it keeps, our muscle attached to our bones, ligaments, and to our structure. It allows our structure to have sound movement through spatial dimension. It's basically, 20% of your conscious distribution. We have our, main processing unit, our brain. We see, we have our vision, we can feel, we can, reinterpret signals and sensations when we're moving. You're conscious in your feet, you're conscious everywhere. So the 20% distribution is throughout your body, and that's your fascia that allows for movement. If we didn't have the fascia, we wouldn't be able to move. So all that stuff, big words, whatever. What does that actually mean for you? So what that means is your fascia allows for movement, and when it's bound or when it's not correctly distributed, it causes pain or limitation or discomfort. So what do? We make sure it's even, rolled out and everything, and it can allow for movement. What happens when we work out and we do stuff? We accumulate soreness and we start getting limited range of motion. It's harder to initiate the movement and move as if, we were fresh. So what do? Well, you're gonna start in the feet. Your myofascial really like to bind at the feet and the major joint areas. We're gonna move through our feet to our calves, hamstrings, hips. Really being careful if we do it on our ribs. Stay away from bony areas. Stay away from going above the shoulders. Stay away from joint areas. You would never roll over the front of your knee. You can kind of be careful on the back of your knee, but you're not going to roll your ankle out. You're not going to roll the top of your knee joint out. You're not going to roll your ribs out. Now there's a case where you can place a myofascial ball or a tool here on your rib cage, lean into it, and breathe gently to open it up, but you're not going to roll over it. That could be dangerous. You can go up higher and roll over your lats, roll over your shoulders. There's a good myofascial release point in your chest. But this is the thing, where we differentiate between myofascial release, trigger point release, and general foam rolling. General foam rolling, you can roll over larger surface areas. Trigger point release, myofascial release is a targeted area that releases a larger area. So here, I'm rolling on my chest, for example. I'm releasing it, but then I find the targeted trigger point release, myofascial release point, and that's gonna release a much larger area. Now, some of you may have come into contact with this from various massage, manual therapists. There's something called Graston that works with the fascia, works out scar tissue. There's a lot of different therapies and techniques that target this. And reflexology is also another type of massage, trigger point release, myofascial release technique. So there's a whole bunch of them out there. We can dive in deeper, but for right now, let's just actually figure out how to foam roll and do myofascial release. And again, foam rolling is rolling over the much larger surface area. Myofascial release is the targeted area that releases a larger area, okay? So where are we starting out? Most likely you'll want to start out, you have to understand this concept, key concept. Densities of foam rolling. Now, if you have more life experience, you're not as in condition, you have injuries, you're going to want to start at a lower density because your body will respond better. You don't want to overwork your body. Foam rolling can be similar to working out. Start low and slow, ease into it. See how you respond. Be gentle. Be mindful. You don't want to rush in and hurt yourself. A tennis ball can be sufficient for a while. A very loose You could use a soccer ball. You could use a much lower density tool or piece of equipment, and that will work. That will be sufficient for you. Now, if you've done this, you might want to go to greater densities, and you may want to use different densities in different areas of your body. So where are we starting out? So I don't have the tennis ball with us, but we're going to start on the tennis ball. You're going to roll your feet out, then go to your calves, then go to your hamstrings, hip, stationary point. You can roll out the abductors and the groin area, inner leg. There's a great myofascial release spot right here for your psoas and for all this lumbopelvic hip region. You might want to roll out your glutes. Then you go up further, you can do a trigger point release here, but you can't roll over your ribs. Then you can roll your lats out. You might be able to roll your shoulders out. You might find a trigger point release in here. In the chest, there's a trigger point release. So again, foam rolling, trigger point release. Okay, so within the densities, the tools that we have, tennis ball is where we start out. And then we can start going into foam rolling. So what we're gonna do again, feet, calves, hamstrings, start from the ground up. Hips, stationary, lats, shoulders, chest, and that's a simple progression to follow. Okay. As far as densities go, tennis ball, then lacrosse ball. Lacrosse ball is going to be intense and pinpointed. This is good for both foam rolling and myofascial release, but a little better for myofascial release. Stationary points. The hip. Find the pant pocket. Target the hip. Chest. Then we move further. You have the foam roller, then you have a larger ball. This can be great as well. Gentle massage. You can do targeted, pinpointed, trigger point, or you can do foam rolling. Some tools do both. Golf ball is great. It's very pinpointed. It's very dense. Probably the highest density you're gonna find. So be cautious with that. Be gentle with yourself. You've probably also seen the wheels. Underneath there's a little bit of padding, but this is a travel size foam roller, and this is PVC pipe. Put a little padding around PVC pipe, that's a great option. PVC pipe alone could be an option, but again, greater density. So be mindful of which you want to use. And then the next step, various densities, differentiating between foam rolling, general surface area, targeted, pinpointed, trigger release. Okay, the next step up, we start getting into more and more tools that have more ability. For example, adding vibration. Okay, why do we do vibration? Why are we adding that component? Well, we may be very sore. We may be weak. Vibration enhances training, enhances foam rolling, enhances massage, enhances myofascial release. It's an enhancement. It's taking it up another notch. If you're having difficulty foam rolling at all, you may want to go right to vibration because it can ease, what it does is it creates better circulation. It creates greater relaxation sense. It creates better blood flow. It enhances the foam rolling. It makes it easier to foam roll. It makes it easier for the relaxation response. It's going to allow greater amounts of oxygen to get to the area you're targeting. So it's going to enhance overall. It could make it also easier depending on, you know, your level, your experience, and what you're trying to achieve. And it's generally overall, you know, better. So something to consider. The options of adding vibration into the, you know, myofascial release, foam rolling, and into your training regimens, into your sports recovery. Vibration is going to enhance recovery. It's going to speed up recovery. So what we found is that, and again, they have various degrees of intensity. What we've found is that vibration, adding in vibration to training, and specifically in the context of foam rolling or myofascial release, targeted release, is that we double, you know, the body's ability to relax, release, and recover. It enhances it. It's twice the effectiveness, as well as 40%, you know, faster recovery. These are studies that have been done. This is the supportive evidence. So that's important to think about. It is an enhancement. It will get us to where we want to go faster. So kind of summarizing here, we've gone over a lot. You know, we're going to go into detail in the next video about just foam rolling, just myofascial release. They're two different things, but they overlap. Just vibrational training, that's an enhancement, but can also be a starting point. And various degrees of density for our foam rolling, for our massage needs, for our training, for our recovery needs. So we've covered a lot. We're going to dive deeper. You let me know what you need, what questions you have, and we're going to do a quick demo. Say I just have a tennis ball or cross ball. I'm going to roll foot. Maybe 10 seconds each area, maybe 30 seconds. You know, if you find something and you go, oh, I found it. Like you find a tender, soft, or a spot, a tight knot, lean into it, push into it, trust it. Combine breath and relaxation techniques. Moving upward, move from the ground up. Oh, I found a spot, push into it, breathe into it, tell and send signals to relax. You know, you've also heard in various, you may have heard in various techniques, movement styles, yoga, qigong, tai chi, massage styles, about unwinding or releasing. There's the tension, there's limited range of motion, and you release and you have greater mobility. Okay, so it's another concept to understand. Moving upward, targeted into the hip. And if I need to move a little, I can, otherwise just target and allow release. And again, build up. If you can only handle 10, 15 seconds, just do that and then move off. You're really careful with the ribs. It's a great release point, but be careful. To the lats. And then finally into the chest. Okay. Now we talk about foam rolling. Similar. It's really great to get into the glutes with foam rolling. All right. That's all for now. Let me know what you need, what you think, what follow-up questions you have. You can, add this in the morning of. It's great to start your day with mobility routines, stretching, release. It's great to do it a little bit before a workout, after a workout, at the end of the day, on your recovery day. It's always available and accessible and useful for you. So consider that. Figure out some follow-up questions, try it out, let me know what you need, and we'll keep building upon these fundamental concepts. Myofascial release, trigger point release, synonymous, foam rolling. So let me know what you think.